Hello, my name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you have joined us today for the Health Careers Exploration Program webinar. Before we begin, I'd like to discuss a few housekeeping items. Number one, this webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the camera, microphone, chat, and view controls in the menu bar at the top of your screens. Number two, the chat option will be open for asking questions during our Q&A session, which is at the end of this webinar. And number three, the webinar will be recorded and will be available within 7 to 10 business days. Here's the agenda for today's webinar. We'll have a discussion, an overview of the program, and then we will go into program elements and key dates. From there, we will discuss application scoring criteria, the program provisions, and then we will go into that question and answer session as we talked about. And then we'll have a closing remarks and end the webinar today. And with that, it is my pleasure to introduce Wahida Nawab, Grants Section Chief for Health Workforce.
Thank you, Chris. All right. Welcome, everyone. My name is Wahida Nawab. I'm one of the Grants Management Section Chief here at HCAI, Office of Health Workforce and Development. Next slide. HCAI's vision and mission. The vision at HCAI here is a healthier California where all receive equitable, affordable, and quality healthcare. Our mission is HCAI expands equitable access to quality, affordable healthcare for all Californians through resilient facilities, actionable information, and the health workforce each community needs. Health workforce development supports an increase a health workforce that serves medically underserved areas, represents the California it serves through racial and language diversity, serves Medi-Cal members, and offer programs that provide financial support for organizations expanding educational capacity, individuals to pursue health careers, scholarship and loan repayment, organizations to build the workforce pipeline. Next slide. All right, thank you. Alrighty, the Health Careers Exploration Program, HCEP. The overview here is the program purpose. Pursuant to the Health Professions Career Opportunities Program, Health and Safety Code, Section 127885, the Department of Healthcare Access and Information will consider applications for the Health Careers Exploration Program that supports and encourages underrepresented and disadvantaged individuals to pursue health careers, to develop a more culturally and linguistically competent healthcare workforce. HCEP's goals. Competitive proposals will demonstrate a commitment to the HCEP goals by implementing one or more of the following components. And here are the following: conducting a conference and or workshop series aimed at informing individuals or opportunities in health professional careers, providing support and technical assistance to health professional schools and colleges, as well as to students and community organizations active in minority health professional development. Conducting relevant workforce research and data analysis in the field of minority and disadvantaged health professional development. And now I will pass this over to Alvira Chavez, in regards to the HCEP program elements and key dates. She's one of our program officers. Take it, Alvira. Thank you.
Thank you, Wahida. Good afternoon, everybody. My name is Elvira Chaidas. I will start with the HCEP eligible health professions. The proposals must promote the following health professions: primary care, behavioral health, caring for older adults, nursing, oral health, and allied health. Next slide, please. The award categories we have two. Award category A focuses on health career conferences and or workshops, and it focuses on introducing participants to a wide variety of health career options by offering health career fair experiences and or workshops. A minimum of 100 participants are required for category A. Category B focuses on hands-on experience in healthcare and it focuses on direct exposure of participants to one or more health careers through hands-on experience that includes direct interaction with healthcare professionals in real or simulated healthcare settings. And a minimum of 50 participants is required for this category B. Next slide, please. Eligible organizations for both category A and category B, HCAI will accept proposals from public and private nonprofit organizations located within California. A nonprofit organization is an organization exempt from taxation under Section 501c3 of the Internal Revenue Code. HCAI will validate the organization's nonprofit status with the IRS as an eligibility component. And individuals are not eligible to apply. It's only for organizations. Next slide, please. The award amounts are for category A, $12,000 or $20,000 with a focus on behavioral health and or caring for older adults' health careers. You would have to have at least 50% focused on the behavioral health or caring for older adults. A minimum of 100 participants are required for category A, which we discussed already. For category B, $15,000 or $25,000 with a focus on behavioral health and or caring for older adults. Thank you. Next slide. The key dates, there's just one minor change here. The webinar, as you know, the applications opened August 16th at 3 p.m. Webinar is today, not the 5th. Deadline to apply will be October 16 at 3 p.m. Award notices will be announced sometime in January next year. Grant agreement start dates will be February of next year. And these are just one-year grants, so they will end January 31st, 2026. The next sessions we will discuss evaluation and application scoring procedures. At the time of applications closing, HCAI will review each application for the presence or absence of required information to conform with the application submission requirements. HCAI may reject applications that contain false or misleading information. HCAI will use the evaluation criteria described in the grant guide to score applications. Next slide, please. I'm not going to read through all of these. I'll just read on the major points. For program information, you will be asked if the applicant's proposed program will take place at a program site in a health professional shortage area known as a HCCA. That will provide a maximum of 25 points. And then program proposal, we will ask if the applicant's program if the program will address the challenges specific to the target program participants and demographics, and that will have a maximum of 20 points. Next slide, please. And again, how will the applicant's proposed program be culturally and or linguistically responsive to program participants? That provides a maximum of 20 points. Next slide. The applicant will be asked if they have experience exposing the following individuals to primary care, caring for older adults, behavioral health, and or other health careers. That will provide 15 maximum points. And does the applicant, can you go back, please? Okay. Does the applicant support individuals from the following groups? 14 points for that. How many years of experience does the applicant have exposing underrepresented individuals to primary care, caring for older adults, behavioral health, and or other health careers? And that provides 10 points. Does the applicant propose to promote primary care, caring for older adults, behavioral health, and or health careers? That is a maximum of 10 points. Also, maximum of 10 points is does the applicant identify specific program objectives that support the intent of the HCEP. Next slide, please. Does the applicant identify how they will encourage primary care, caring for older adults, behavioral health, and/or other health careers? That's just a continuation from the previous slide. Okay, does the applicant's program include any of the following activities? And that provides a maximum of 10 points. Next slide. How many activity days per year does the applicant's program include? 10 points. Will the applicant's proposed program provide students with access to internships, fellowships, or shadowing hours in primary care, caring for older adults, behavioral health, or other health career fields? 10 points. And we'll go back to the other. Thank you. Will the applicant's proposed program provide the following services to support the student's academic success? That's maximum of 8 points. A total of 172 points are possible. And that concludes the scoring session. So now we're going on to the grant application process. So the application, the EAP application has 12 sections. General information, program information, add a partnering organization, add program sites, percentage of health careers, program proposal, program objectives, qualitative questions, there are 3, organizational experience, services, program budget, contract administration, and assurances. Next slide. For the budget detail, we will ask you to include advertising, meals, supplies, transportation, facility costs, indirect costs. And indirect costs, please note that is a total that should not exceed 15% of the total grant amount. Next slide, please. The post-award and payment provisions. HCAI expects the grantee to begin performance of the grant agreement on the start date listed on the grant award documents. The State Controller's Office mails a paper check directly to the grantee's address on file. Please ensure that HCAI has your organization's most recent address, which must match the address you have listed with the IRS as well. This will avoid delays in payments. And this address must also match the address that grantees provide on the STD 204, which is the pay data record form, and that is a mandatory required document. Grantees must abide by the schedule of the deliverables. HCAI will not make changes to any terms and conditions specified in the grant agreement. If your organization is awarded but refuses to sign the required grant agreement documents by the deadline, you may lose your award. Extensions to this deadline will not be considered. HCAI reserves the right to recover monies for a grantee's failure to perform services and other grant agreement obligations. Next slide, please.
All right. Well, thank you so much,
Okay.
Elvira.
Thank you, Chris.
As you can see, our team has put a lot of work into this program, and we are excited that you have joined us today to learn more. We are going to transition into our question and answer session. The chat option should be opening, and you should be able to access that in the menu bar at the top of your screen. We do understand that some of you may not be able to access the chat feature in the browser version of your Teams due to organizational restrictions. Some find that the mobile version does provide that chat access. If you're still unable to access the chat feature, please email your questions to hpcop@hci.ca.gov. That's hipcop@hci.ca.gov. It's also in the chat. Thank you for your understanding on that. We will answer questions in the order that they're received, and we'll do our best to get through all of the questions that you have. And so let's go ahead and go into the questions here. I see they're starting to show up. All right. Arlene asks, thank you for providing this information. Will you be sending these slides out to us? Yes, we will be providing the slides. I believe they may already be available on our website, but we will send the recording and the slides to everybody who registered for this webinar within 7 to 10 business days. All right, next question. Are programs that support only pre-medical students eligible? I noticed the language is to promote all health careers. Elvira?
Sorry, Chris, I can't see the questions on my end. Can you repeat that, please?
Yeah, and you can see them in the chat as well. If you click on the chat at the top, you'll be able to see them, Elvira. The question is, how's not working for you? All right, we apologize. We're having some technical difficulties today. The question is, are programs that support only pre-medical students eligible? I noticed the language is to promote all health careers.
Yes, pre-medical students are eligible.
All right, thank you. Next question, Robert asks, do you anticipate this being a one-time program or will it be offered in cycles?
Thank you, Robert. Well, I can't really answer that. HCEP actually used to be the mini grants program, and it's all dependent on funding. So for this cycle, it's just a 1-year contract.
All right. Clinton, did you have something to add to that?
Yes. Hi, my name is Clinton Ramsted. I'm the program manager. We will have cycles every year. We do have annual funding, and so we will have a cycle every year.
Fantastic. Thank you. All right. Next question is from Daira. Thank you for this information. Do we get a list of applicants that are eligible, a copy of their application, or how do we determine their eligibility?
I'm sorry, I don't really understand. Do you get a list of the applicants? Can you please clarify that?
Yeah, Daira, do you mind providing a little extra clarification on what specifically you're looking for as far as which applicants are you talking about?
You can also, if you would like to send an email to the HIPCOP email, hccop@hcai.ca.gov.
I believe there's also a list of eligible an eligibility list within the grant guide. Is that right, Elvira?
Yes, that is correct.
Dara, if that doesn't answer your question, go ahead and email us, and we'll do our best to understand exactly what you're asking and figure out how to help you.
Thank you.
All right. Genesis asks, is this mini grant related to the HCCP program? Will HCCP open this year?
The HCEP program is not really related to the HCCP program. It has a lot of the similar objectives and wording in the grant guides, but no, they are different programs. The HCCP programs are usually 3 to 5 year grants. HCEP is only a 1-year grant. And as far as HCCP opening this year, at this time, we are not opening this year. Is that correct, Clinton?
Buddy, that is correct. We will not have an HCCP cycle for this year due to funding, but we hope to that we will be able to do so in the following year. But this next year, no.
All right, thank you. And next question, Kim, as for the website, I did repost all of the links in the chat. You have the link for our Health Professions Career Opportunities Program, which will link you to the HCEP site. You can link also to the grant guide directly. Also, the technical assistance guide is linked in there, which will give you instructions on how to fill out the application. And then the slide deck for this is linked in that on the one webinar presentation material. And then lastly, that email address that you can email us at if you do have additional questions. All right, next question. Jenny asks, how much total funding is available for all grantees?
How much we have, I believe, $200,000 available for HCEP funding for this cycle.
All right, thank you, Elvira. And
Sure.
so go ahead and keep those questions coming here. We've got plenty of time today to get through all of your questions.
I can add something, Chris, which
Yeah.
I didn't mention earlier. It is highly suggested that you don't wait until October 15 or 16 to submit your application, because in past years, we have had applicants that either have technical issues, cannot log in. There's just a variety of reasons. So please submit your applications as soon as you can in case you have any questions or are having some difficulties with your application. Thank you.
Yeah, that's a great note. Thank you, Elvira. All right, Lori, next, we've got the next question from Lori. Oh, Clinton, did you have one more thing to add on that?
Hi, everybody. I just wanted to remind you that we have a grant guide up on the hci.ca.gov website, as well as a technical assistance guide to help you through the process of navigating your application. And so these are wonderful resources that mainly Elvira has worked very hard on to provide for you. And I would recommend that you take a look at that, because it'll help you immensely as you try to get through your application. And then, like Elvira said, please try not to wait, until the last couple days to apply, because if there are problems, you may have a really hard time getting your application in on time and may not be eligible. Because of our limited funding, this will be a little bit more competitive of a process. So highly encourage you to try and get your application in early, just like Elvira had mentioned. Thank you.
All right.
Thank you, Clinton. Thank you.
Yeah. Next question from Lori. Hello, is there a way to preview the entire grant application within the portal or other places? Thank you.
Lori, thank you. I don't believe that we have I believe you're requesting a PDF version of the application. I will check into that, but I do not believe we have that available. If you send an email to the HCAI email with, I can respond to that and provide it.
This is Clinton again. Just a gentle reminder, the technical assistance guide is basically a copy of the application, screenshot by screenshot by screenshot, with an explanation of what you'll be asked in the application. So the technical assistance guide would be your best resource for that.
Absolutely. Thank you. All right. And thank you, Lori, for that. And that's a great plug for that technical assistance guide. Really is a very helpful document for navigating it all. If you do have questions, please email us at hipcop@hci.ca.gov. Next question. Will you be publicly announcing the winners?
I like that, the winners. Yes, the awardees will be announced after the applications are reviewed and scored. We actually provide the notice on the website, And if you, for the awardees, the applicants that are awarded, you will receive an individual notification as well.
All right. David went ahead and dropped a link just to the TA guide. All of the links can be found under the resources if you scroll through the chat, but there it is for you directly. We will also be sending an email out to everybody who's registered with the recording, the slide deck, and a link to all of the resources. So we'll make sure that many ways for you guys to get access to all of the information that you need.
I can add something real quick, Chris. The awards will be announced. Sorry, I forgot. I think it's in early January. If we can go to the key dates. So because this also happens periodically, where if you have a change in your address or program staff, please send a message to thank you, January 2025. Please send a message to the HIPCOP email and let us know about any staff email changes, please. Thank you.
All right. Just out of curiosity, if anyone's having trouble accessing the chats, would go ahead and put a thumbs up or maybe a surprise face. There you go. Do a surprise face if you're not able to access the chat. I'm curious to see if we're having issues with access. All right, not seeing any surprised faces, so that's good. You could do that if you are having trouble. The react button up at the top in the menu would be how you do that. But just trying to make sure that everybody is able to access it. It does look like we've seen an update in our Teams interface, and so we'll make sure that we're not having any technical difficulties there. Any other questions today? Well, we have Clinton and Elvira available to answer them.
Actually, Chris, let me expand a little bit on the announcement. If you go to the website under the resources tab, there will be a new tab with a link that will say, I believe it'll have HCEP awardees for 2024 or something like that. So you don't see it on the website currently. Again, that will not be posted until sometime in January.
All right, we got the next question. Lori asks, on page 1 of 2 of the grant application, I'm unable to enter our organization name in the first question. Is there a workaround?
Yes. Hi, Lori. I think it's probably best to work with you one-on-one with that, just so I can get a clear understanding of what's going on with your application. Can you send an email, please?
All right, thank you. And one of the other things, you may want to make sure that profile is all set up and everything. I believe that's sometimes an issue if you don't have your profile set up correctly. All right, Jenny asks, I understand HCCP will not have a cycle next year due to funding. Is this impacting funding from previous HCCP grant agreements?
I'll let Clinton answer that one, please.
Hi, folks. This is Clinton here. No, it will not impact previous awardees. Okay, when we have the money to make an award, like the HCCP programs, 5-year awards, we secured the funding for all 5 years. So all that'll happen is that we will not be able to make new awards next year. But all the awards that were already done, no problem. You don't have to worry about that.
All
Thank
right.
you.
Thank you, Clinton. Thank you, Jenny. We appreciate getting to partner with all of you guys, and we know you guys are doing amazing work with these pipeline programs. All right. Next question. It's not clear. Does my private practice need to be nonprofit to be able to apply?
Yes, nonprofits.
All right. Thank you for that question. And one more time as a reminder, while we're waiting for more questions here, just take us about 7 to 10 business days to get the recording with its captions, and then we will be sending that out to everyone. So in that time frame, you should see another email from us with the recording link, the slide deck link, and all of the other resources that you need will be coming to all registration attendees in the webinar. And give another minute here for questions to come in, and then we'll move on to our closing remarks if there are no more questions.
Thank you, Chris.
Yeah, and I'll before we move on, I'll say it one more time. Please look in the chat, scroll up in your chat. You can find the resources link in there a couple times. It's also pinned at the top of the chat, so you can find all of your information there for those resources and the slide deck. I'm not seeing any more questions come in, so thank you all for your participation in our Q&A session. We really do appreciate your guys' participation. This is why we run these webinars, is to make sure that you guys have a chance to ask all the questions that you may have on the process. If you do find that you have more questions, please email us at hcai.ca.gov. That's hpcop@hcai.ca.gov. And as a reminder, we will be posting the webinar and the slide deck within 7 to 10 business days. We do appreciate everybody joining us. I'm going to hand it back to Wahida for some closing remarks.
All right. I want to say thank you for all of you in joining us and spending this time to go over this HCEP webinar. And I wanted to also let you guys know, if you could, Chris, go to the next slide, that you could also find us on Twitter, YouTube, and Facebook, LinkedIn, and you could just hashtag us and look us up, or hashtag us and tag us in some of your work. We would appreciate it. All right. Next slide. I noticed that we do have our mailing list here at the top in case you guys need it. And of course, you'll get a copy of these PowerPoint slides, so you'll have it handy. Chris, can you go to the next slide, please? All right, and we have our contact number. It's 916-326-3700, and our email here at hpcop@hci.ca.gov. Please feel free to send us an email if you have any questions or concerns. Again, thank you all for your time today.
All right, thank you so much, Wahida. As a reminder, the application deadline is due October 16th, 2024. Thank you so much for attending today, and with that, we do conclude today's webinar. Have a wonderful day.